Hi, this is Theresa Palkovic from Valley Rehab Center. In a previous video we talked about causes for back pain and sciatica. One of those causes was Piriformis Syndrome. The piriformis is a muscle that lays across your buttock. It's one of the biggest muscles in your buttock. It attaches along your sacrum. It comes out here and actually attaches on your hip. It actually rotates your leg out and assists with bringing it out to the side. That muscle can become inflamed and tight for a lot of reasons. In men, sometimes it's caused from sitting on their wallet or carrying their wallet in their back pocket. For truck drivers, it's caused from sitting and operating their truck all day long, moving from the brake to the gas to the brake to the gas. Sitting, people who sit at desks for long periods of time will get a tight piriformis. The piriformis can actually cause you to have sciatica or pain down your leg. It can cause you to have numbness or tingling down your leg. It can even cause you to have a loss of sensation in a certain area of your leg, or even some weakness. That's because the piriformis is pinching off the sciatic nerve, because in about 60% of the population, the piriformis, the sciatic nerve actually runs through the belly of the piriformis. And so if that piriformis is inflamed and irritated, it will cause a lot of discomfort. So there are a couple of things you can do if you have Piriformis Syndrome. One thing you can do is sit, place your ankle on your opposite knee, sit up like this, and then just gently lean forward. If you feel that you're tight in your buttock, that's piriformis. You want to come forward. You want to hold that position for 5 to 30 seconds. Now, it's important that you realize in this situation, pain is not gain. You're going to go to where you start to feel discomfort, but you don't push into pain that you can't stand. You just come to where you feel the stretch, slight discomfort, wait 30 seconds, and then relax. And you want to repeat that 3 to 5 times for 30 seconds. It's very important that you hold that stretch for 30 seconds because the muscle is just like a rubber band. If I take a rubber band and I keep going boing, boing, boing with the rubber band, it's going to keep going back to its original length. However, if I take a rubber band and I hold it at an extended length for a period of time, it's going to go back, but it's going to actually be a little bit longer. And that's what we're trying to accomplish here. We're trying to get that piriformis stretched out to be a little bit longer and a little bit more flexible so it's not irritating the sciatic nerve. Another way that you could stretch the piriformis is to lay on your back. Again, put your ankle on your opposite knee. In some cases, this is as far as somebody can get when they first start this. Then you can inch your leg in a little bit further and inch it in a little bit further until you feel the stretch. You can also use your hand to push away. In all cases, you only want to go to where you feel the stretch and hold that for 30 seconds. Do that 3 to 5 times. If you find that you're not getting much of a stretch here, you can always lift this leg. However, when you lift this leg, you want to make sure that you flatten your back first so that your abdominals are tight, and then bring your leg in. And that'll give you some further stretch. Again, hold that stretch for 30 seconds, release it, and do that 3 to 5 times. If you're having pain in your buttock and it feels like you have a knot there, that could be spasm in the piriformis. So another technique you can use to help get rid of that spasm is to get yourself a tennis ball, lay on your back with your knees bent, place that tennis ball under your buttock right at the area that you're having the discomfort, and then you can actually just bring your leg out to the side and back in, take it out, leave it there for maybe 20 to 30 seconds, and come back in, and then back out. You can straighten your leg and roll in and out over the tennis ball. And that kind of like self-massages the piriformis and helps it to relax. With any exercise program, if anything causes you an increase in pain, you should stop that activity immediately and consult a healthcare professional.